Okay, so this is the insertion of the in and out catheter. You will do this on the male. So you will perform both of these skills for this skill check off. So you'll do the indwelling on the female and you'll do the in and out on the male. So once again, we're going to position our patient. We're going to check our package for integrity, make sure it's not expired. We're going to open, and as I said before, we'll use our bed. Now with both of these, you might find some videos out there where they use the bedside table. I find it a little more awkward to use the bedside table, but it's up to you, you know, it's up to you. Once again, you will provide peri-care. With the male, if they are circumcised or uncircumcised, you want to make sure that you pull back the foreskin, and then when you're finished, you want to make sure that you replace the foreskin, and you've got to make sure that you say that as part of your skill. Okay, so let's get started. Back here. Okay, once again, I'm going to get my sterile gloves out. I'm going to get this drape out, and I will olay. And for me, with the male, I sometimes do use this fenestrated drape. But, once again, it can get you in trouble. Remember how I showed you with the female and it got floppy on us? So that's another thing that you need to be mindful of. If you choose to use it, then be aware that it may very well not cooperate and want to flip back on you or fold over on you. So it might be best to just not use it, but I'm going to show you if we were going to use it. With the male, it does stay in place a little better, but not a lot, okay? So I'm going to leave it on there, and then we'll just see if it cooperates or not, okay? So let me open up my sterile gloves. Okay, that's going to just flip over. And I will tell you, if you have bigger hands, the surgical gloves that come in your kit is probably what you want to use. If you have smaller hands, usually we can make these work. The problems come is if you're using those and you have small hands, then you know you have those tippies, and then you're more likely to rub them on something and lose your sterility with your gloves. Right, pair number 2 that didn't rip. How about that? Okay, so now I can touch this because it was sterile and I have on my sterile gloves, and pull it down. Okay, so in this we have swabs that we'll be using. We have our specimen cup, and that is kind of part of this skill. There are extra swabs. It's new. I've not ever seen the extra swabs in there, but I'm just going to drop them in my sterile field because once I open this, I may find that I need them for whatever reason. This is my lubrication, and then I have my cap and my label. You know, most of the time now we have pre-printed labels, so I'm not going to worry with that. Your cap, you always want to set it lid up, and you see that I left my sterile glove package open That's because after I get my urine, I'm gonna actually set that over there so that I don't make a mess on my side table. Because if you try to set that down, or if you try to put the lid on one-handed, etc., sometimes that becomes a problem. So I'm gonna set my lid down with the inside up. I'm gonna go ahead, for this particular skill, we are gonna have you open your package. Okay, and I would suggest you kind of wiggle them around in there. Move them up and down a little bit so that they're not so difficult to get out. And you can set that right there, and then I'll put that over there, the trash. Okay, so once again, you can open it and put it in there, or you can open it and squirt it in. It's whichever you feel more comfortable doing. Either way, the lubrication is kind of sticky and will somewhat hold it in place. The other thing to keep in mind is this little notch has a purpose. I find it difficult to use sometimes, but I'm going to try to use it in this demonstration because it's supposed to hold your catheter there in place, and then you can much easier it's much easier as far as transitioning and somewhat. Okay, so I'm gonna put my catheter back in there, and it's staying in the lubrication. We don't want it to flop around. Stay. All right, so now I'm gonna get my dirty hand. The thing you need to keep in mind, and of course my nose itches, is that you want to straighten the penis. So you're gonna grasp and you're gonna straighten the penis. And this is a little different. With the female, we went from the outside and did the last swipe in the middle. For this one, we're gonna start at the center, at the meatus, and we're gonna do a circular motion. We're gonna come out, we're gonna drop. And then working our way outward, circular motion, out of the sterile field and drop. And then last, circular motion and out and then drop. Okay, so now I am ready to insert my catheter. So I will pull my catheter out, and I can just drop my lubrication there, or you can leave your lubrication in the tray. You'll tell them to take a deep breath, bear down like they're gonna urinate, and you will insert until you see urine. Once again, this is when the sterile process is over. You don't want to ever let it go, so I'll hold it here just outside so that then I can collect my urine specimen. And yes, urine is probably going everywhere at this point, but there's not a whole lot you can do about that. So I've gotten my appropriate amount, and as I said, I kept that open so I could set that, because I am not a one-handed, what's the word? My dexterity is not that great. So we are going to allow the urine to, or the bladder to empty, so the urine to continue until the flow stops. And then once the flow stops, then we will tell our patient that we're going to withdraw, and so then we will once again take the catheter out. Now, here's the thing. You can take this loose and you can put it in your gloves, but ultimately you're going to throw all this away, but you would want to discard the urine. So it's kind of whatever you think is best. So I'm going to roll my catheter up in here, and I'll have a set of clean gloves, right? So then I'd put on my clean gloves. The first thing I would do is put my lid on with my clean gloves on. Put clean, if I needed to wipe off my container in any way, I would do so. Put my label on, put it in the appropriate bags to go to the lab. and then I would clean up. So I would empty or measure if necessary. Most likely we wouldn't be measuring at this point, but you never know. And then clean up everything, and that's that skill. It's pretty simple. It's the easier of the two, really.